Hey everyone, and welcome back to The Explainer. Today, we're diving into a really fascinating and incredibly common medical topic. But we're not just looking at the science today. We're also going to break down the exact English terminology so you can really hear the pronunciation and master the vocabulary behind toxoplasmosis.
So let's start with a question. Could your cat be harboring a microscopic secret? Now, harboring is a great word. It basically means hiding or keeping something safe. It's the perfect way to describe what we're looking at today. Because, well, a lot of us have pets, right? Let's uncover the actual science and the precise English words for what might be living inside them. All right, here is our roadmap for today. 1. Meet the parasite. 2. The cat connection. 3. Modes of transmission. 4. Symptoms and risks. 5. Medical treatments. And 6. Prevention. Okay, Section 1. Let's officially meet the parasite, Toxoplasma gondii.
So what exactly is toxoplasmosis? Basically, it's an infection caused by a microscopic parasite called Toxoplasma gondii. Let's really look at those describing words for a second. Microscopic means it's totally invisible to the naked eye, and it's single-celled, meaning this entire living organism is quite literally just one solitary cell. And because it's a parasite, it absolutely has to live inside or on another organism just to survive.
If you actually zoom in on Toxoplasma gondii under a microscope, you'll see it has this very distinct, kind of crescent-like shape. But what's truly wild about this organism is its global reach. It's found all over the world, and it can persist, which means it continues to exist and survive for an entire lifetime inside the bodies of both humans and animals. Crazy, right? Moving on to Section 2, the cat connection. Let's break down definitive versus intermediate hosts. In biology, we actually have two different types of hosts. First, you have definitive hosts, which are felines. Yep, that includes your fluffy domestic house cat. They're unique because they are the absolute only animals where this parasite can reproduce sexually. On the flip side, you've got intermediate hosts. That includes us humans, along with all other warm-blooded animals. Inside of our bodies, the parasite can only reproduce asexually. The life cycle of Toxoplasma is honestly like a giant biological puzzle. The parasite reproduces inside a cat's intestines, and then it's shed, meaning it's released, into their feces. These tiny infectious particles are called oocysts. And here is a really important detail. It takes a minimum of 24 hours for those shed oocysts to actually become infective to humans. After that 24-hour clock ticks down, they can easily be ingested by intermediate hosts, livestock, mice, or, well, us.
So, Section 3, Modes of Transmission. How exactly does this tiny organism spread?
There are 3 primary ways it spreads to humans: foodborne, animal to human, and mother to child. Now, in the medical world, that third route is called congenital. Congenital. That just means it's a condition present right from birth. In our everyday lives, transmission usually happens through undercooked meat. We're talking especially about pork, lamb, or wild game. Another massive culprit is unwashed produce, like fresh fruits and veggies that still have some contaminated soil on them. You can also accidentally ingest those oocysts we just talked about by directly handling contaminated cat feces or even just touching infected soil and water while you're out gardening.
Okay, Section 4, Symptoms and High-Risk Groups. What actually happens to your body once you're infected?
Well, the body's reaction varies a ton. For most healthy folks, a staggering 80 to 90% show absolutely zero symptoms, none. Their immune systems are so strong that they just keep the parasite completely in check. At worst, they might get a few mild flu-like symptoms. But for high-risk individuals, it's a totally different story. A dormant or sleeping infection can suddenly reactivate, and that can lead to some really severe, life-threatening organ damage. So who is in these high-risk populations? It includes pregnant women, infants, and immunocompromised individuals. Let's sound that one out. Immunocompromised. That simply means a person's immune system is weakened. It's just not fighting at full strength. We're talking about patients with HIV/AIDS, folks going through chemotherapy, or people who've recently had an organ transplant. If left untreated, the medical complications for these high-risk groups are incredibly severe. They can develop encephalitis, which is a really dangerous inflammation of the brain. There's also ocular disease, which can literally cause blindness. Then there's hydrocephalus. That's a condition where excess fluid builds up on the brain, and it's mostly seen in newborns. In the worst cases, it can even cascade into complete organ failure.
But there's good news. Section 5, Medical Treatments and Medications.
Doctors have ways to fight back. Medical treatments specifically target the active stage of the parasite. In English clinical terms, that's called the tachyzoite stage. Tachyzoite. But here's the catch, and it's a pretty big one. While today's medicines are great at hunting down the active parasite, they literally cannot eliminate the dormant tissue cysts. Those sleeping ones just stay put. The most effective clinical approach is what's called combination therapy. Usually, doctors will pair two specific medications together, pyrimethamine and sulfadiazine. Pyrimethamine and sulfadiazine. When you put those two together, they aggressively attack the active parasite.
But wait, there's a slight complication. Pyrimethamine can actually be pretty toxic to the human body. So to balance that out, doctors almost always prescribe a third medication called leucovorin, also known as folinic acid. Its specific job is purely protective. It shields the patient's bone marrow from that toxicity.
Now, for pregnant women, doctors use a totally different protocol. They use a medicine called spiromycin. Spiromycin is given very early in a pregnancy, specifically before 18 weeks, to greatly lower the chances of passing the infection onto the developing baby.
All right, Section 6. Let's bring this all home with essential prevention strategies.
Keeping yourself safe basically comes down to a few really simple daily habits. For food safety, make absolutely sure you cook all your meat to 160 degrees Fahrenheit, which is 71 degrees Celsius, and please, wash your fresh produce. For your cats, keep them indoors so they aren't out hunting. Feed them commercial cat food, and this is absolutely crucial, change their litter box every single day. Remember that 24-hour biological timer we talked about earlier? If you change the litter daily, you are literally throwing out the oocysts before they even have a chance to become infectious to you. And there is one totally non-negotiable rule we have to mention. High-risk individuals should absolutely have someone else change the cat litter. No exceptions. It's just such an easy, vital step to protect pregnant women and immunocompromised folks from accidental exposure.
We've covered a lot of ground today, from understanding a single-celled, microscopic parasite to practicing some pretty complex English medical vocabulary, all the way to laying out daily prevention rules. So I'll leave you with this. Now that you actually know the science and the terminology behind the Toxoplasma life cycle, how are you going to change your daily routine to stay safe? Thanks so much for joining us to master these concepts today. Catch you next time.